is in Christchurch. He was in the operation theatre assisting something, and they were just asking him pharmac questions, and he pronounced a drug that obviously I had taught him. And almost the entire operation theatre started laughing. Like the surgeon started laughing, and the head nurse started laughing, and he goes, "Why are these guys laughing?" They were like, "Reshma was your tutor."
How long have you been tutoring? You're only young.
Oh, thanks. 3 years now?
Doesn't know why I'm saying it.
Tutoring 3 years. But I'm quite popular. Yeah, so you're going to get that too. Reshma has taught you this, right? Okay, so it's awesome. Just pronounce drugs the Indian way. Beautiful. So that's the mechanism of action. Those are a few examples. Now going on to the important things about steroids. How do I put this? Cautions and contraindications.
Can you, explain to me what contraindications are?
Which are the conditions where you will never ever give steroids? Caution and contraindication for steroids. Now please remember, you know, right, your body has got adrenal gland, and the adrenal gland has got adrenal cortex and adrenal medulla. The adrenal cortex produces corticosteroids as well. Yeah? When you're externally giving, do you know of the pituitary gland?
Yeah.
Beautiful. Oh, thank you. So, we've got the beautiful adrenal gland, and the beautiful adrenal gland secretes steroids. How does it secrete steroid? It gets positive feedback from the pituitary. The pituitary gland secretes ACTH. Have you heard of this?
Yeah.
No? ACTH is adrenocorticotropic hormone. Adrenocorticotropic hormone is the pituitary hormone, and that hormone, the function of that hormone is basically telling the adrenal gland it's the time to secrete steroids. Okay, so it's a stimulation for the adrenal gland to secrete steroids. Now what happens is, when you're externally supplying steroids in the form of medication, what's going to happen? There's going to be too much steroid in your body. Internal steroid as well as external steroid, and this too much concentration of steroid in the body is going to tell the pituitary, increased steroids in the body is going to tell the pituitary, hey, we don't need any more steroids, so decrease ACTH. Does that make sense? So increased steroids in the body is going to tell the pituitary to decrease the secretion of ACTH. So can I say that the normal stimulation of your adrenal gland is declined? So the functioning of your adrenal gland is going to decline over time? Yes? And that's one thing that you need to be careful about, adrenal gland suppression. Adrenal gland suppression. Now, what is all this? We've got enough steroids. Externally, you've got given a lot of steroids. Now, that is causing a decreased ACTH, and that's causing decreased functioning of the adrenal gland. Now, how is this harmful? This is harmful because one fine day, if the patient says, or you say, let's stop steroids, you don't need steroids anymore, and you suddenly cut off the supply of steroids, the body hasn't had the time to adjust to the new change, and there will be a state where there is no steroids in the body at all. Does that make sense? Because externally the supply has stopped, internally there has been an inhibition. And that is adrenal gland insufficiency, and this can kill a person.
Oh, wow.
Or we call it adrenal crisis. Adrenal gland insufficiency or adrenal crisis. And how is that going to work? It's going to cause shock, decrease blood pressure, increase heart rate, problems with vasodilation, and the person can actually die. So this is one thing you need to be careful about. that once the patient is off on steroids, you have to remember that the adrenal gland is going to be suppressed. And that is why you cannot have a sudden cessation of corticosteroid treatment. It has to be gradual withdrawal. Does that make sense? You need to give your body time to get used to the low doses of steroids. Are we good, doctors?
Yes.
Beautiful. Yeah.
Does that shock have a particular name?
It is called hypotensive. It will be a type of hypotensive shock. Okay?
Sorry. Hypertensive?
Shock
Hypotensive shock.
is
Got it.
always
Oh, yeah.
hypotensive. Are we good, doctors? So that's one thing. The second thing with corticosteroids. Did I say that they were decreasing protein synthesis?
Yeah.
And when I said that, it is happening to protein synthesis of all the cells of the body, all your immunity cells. Yes? Yeah, so it is causing decreased immunity as well. And this decreased immunity can lead to repeated infections. And which are the infections that we need to be careful about? TB, chickenpox, measles, TB, chickenpox, measles are the common infections that can happen to patients, and that's why monitoring is essential.
If I've already had chickenpox and I've been vaccinated against measles.
Then the possibility of that happening is very low, but it could still happen. All good? Yes? Another thing. Huh? Question? Did anybody have any questions?
What? I don't know if you're going to talk about it, but why do you get fat when you're on steroids?
Beautiful. I'm going to talk about it. I'll definitely talk about it. So we spoke about infection, we spoke about adrenal gland suppression, we spoke about you need to be careful with the withdrawals. Righty? What are some other problems that can happen with corticosteroids? Corticosteroids by themselves are responsible for increasing your blood sugar level. Increases blood sugar, so the person becomes hyperglycemic. So you have to be careful in patients with diabetes, exactly. So exercise caution in patients with diabetes.
Sorry, Rishma, why is that? Like,
Because they will act sort of increase in cell synthesis, gluconeogenesis.
oh,
It acts on the liver and enhances gluconeogenesis. Another thing that can happen with steroids, one of the common side effects of steroids is Cushing's syndrome. Have you heard of this?
Yeah. Don't know what it is, but here's the word.
Cushing's syndrome. Increased steroids in the body. Either you're giving it externally or somehow, for some reason, your adrenal gland produces the most steroids, will give you Cushing's syndrome. Now, what happens in Cushing's syndrome? There is fat deposition. That's why you get fat. Fat deposition, mainly where? Around facial area and truncal.
Does that mean what's truncal?
Puffy face and around trunk.
Is this a contraindication or a side effect?
It is a side effect, and obviously patients with Cushing's syndrome, you won't give steroids, so it fits into both. What else will happen with Cushing's syndrome? It causes thinning of the skin. Okay, it causes thinning of the skin and decreased collagen, as a result of which there will be increased bleeding tendencies.
Rishma, can you please just explain